Thank you, Mr. Acting President. I don't think that anyone can deny that there are major issues of concern in the Victorian Ambulance Service, and over the last 30 years that I've been involved in health and community services, it has been forever thus. We need look no further than the recent work cover inquiry or the service's ongoing recruitment and retention woes to have provided compelling evidence of this reality. Likewise, the submissions from Ms Purcell and Dr Mansfield provided excellent life experience of the reality in the service. I don't know how many people understand the nature of the work that AMBOs undertake. Some years ago I did a project with New South Wales Ambulance Service and their union, and we travelled around all over New South Wales talking to union reps and to local management, trying to develop better consultative processes and to address the challenges that these workers face. And we spent many hours talking about the reality of life on the road. I learned firsthand that being an AMBO is hard physical and emotional territory. AMBOs, and especially paramedics, are regularly encounter and must address scenes of heart-wrenching disaster, of folly and of tragic consequences, of situations where their exceptional skills literally make the difference between life and death, sometimes successfully and sometimes not. And then, in a jarring contrast, they may next frustratingly find themselves for hours ramped on a hospital, waiting for the ED to clear, while work that requires their skills and dedication is delayed or even goes unanswered. This is a difficult life that requires extraordinary, skilled and committed staff. In this context, it is deeply disturbing that a range of sensible improvements to the working lives of ambulance officers have largely been rejected by the government. The Ambulance Union is seeking improved occupational health and safety conditions, safer staffing levels and better protocols in control rooms, more flexible working arrangements, and a pay rise that at least keeps track with the cost of living, that they don't become poorer for the privilege of their work. Outrageous demands, aren't they? To the government we say that if you value this critical workforce, you need to put your money where your mouth is. But at the same time, we should recognise that there are a range of factors, many of them arising from the pandemic, both past, present and continuing, that have hit many employers, including the ambulance service. Employers everywhere are struggling to find skilled staff, and it would be foolhardy to imagine that the ambulance service is somehow immune. There are some positive initiatives underway, which is great to see. Last year I attended a ceremony with VUT and Brimbank City Council to start the process of establishing a dedicated paramedics training school. Like all such initiatives, however, it will take time to establish and then to ultimately replenish the workforce. And as I said before, these are highly skilled and trained health professionals, and such programs take time to bear fruit. So to come to this motion, we've not had much time to consider it, and that's a real pity. And I mirror the comments of Ms Purcell and the Greens with regard to the lack of opportunity to discuss this motion before it was presented before this place. As I have said, there are patently major problems in the Victorian Ambulance Service. I think it's regrettable that this motion is mainly restricted purely to MICA, as I'm sure all AMBOs would agree that MICA only really works in the context of a well-organised service appropriately tasked across the full range of required assignments, and to look at their position in isolation is fails to do justice to the complexities of the problems. In terms of the actions that are sought in this motion, we agree that the ambulance service should be resourced appropriately. Who wouldn't? I doubt that anyone in Victoria would dispute this principle, but the question is, what does it mean? I'm old enough and sufficiently steeped in the health industry to remember what adequate funding of the ambulance service meant under successive coalition governments going back to the Kennett days, and it was not pretty. As I mentioned previously, the motion seems to concentrate only on MICA and the air wing, and we all know that this is only a small part of the problem. On the question of the documents sought, we accept on face value the undertakings provided by the government, and that's namely that there is no review into MICA by Ambulance Victoria that can be provided or that exists. And secondly, that the safety audit by Pell Air has been distributed to all relevant staff. In this regard, it seems to us that the motion is basically mistargeted. Accordingly, we will not be supporting the resolution. Thank you.